Welcome everyone to the Bizibuz webinar on child vaccinations in Hong Kong. Thank you for joining us today. I'm a Hong Kong parent of 2 children and so equally concerned with today's topic. I'm also the founder of Bizibuz, which is a data-driven learning platform that uses smart algorithms to optimize a parent's selection and booking of quality after-school activities that cover both online and offline courses. If you're interested in joining our community, please follow the link pasted on chat or follow us on social media. The links have just been pasted. So with that, we're honoured to support our parent community in Hong Kong in light of the government vaccination requirements for children to attend school with this webinar with Dr. Agnes Leung. Dr. Leung is a paediatric specialist and a college-accredited specialist in paediatric immunology, allergy and infectious diseases. She's an assistant professor in the Department of Paediatrics at the Chinese University of Hong Kong and works in the Prince of Wales Hospital in Sha Tin. Before I hand it over to Dr. Leung, we'd just like to point out this webinar is for educational purposes only and is not intended to be a substitute for professional medical advice. Dr. Leung will speak for around 20 minutes, then there will be an opportunity to ask questions. So feel free to type them in the Q&A area during the webinar. You can find the Q&A area by locating the icon, which looks like a triangle, circle and square at the lower left of your screen. Dr. Leung, the floor is now yours.
Thank you, Chrissy, for the very kind introduction. I'm just going to share my screen. Share. Okay, so can everyone see my slides? Okay, so thanks all the parents for coming to the webinar today despite your busy schedule. So there are a lot of informations out there. I've talked to a lot of parents. Currently, we're information overloaded, and there are actually a lot of myths out there leading to very difficult decisions. So what I'm going to give you today is some very updated as well as factual information about the pandemic, about the COVID-19 infection, as well as about the COVID-19 vaccines for our children. So I've no financial disclosure. So this is going to be the outline of today's talk. So in order to know how to deal with it, we need to know about our enemies first. So what is Omicron and how is it different from the previous ancestral strain? Why do we really need to be vaccinated in the first place? Are the vaccines effective and are they safe? This is our main concerns. And I would like to end with giving you some practical tips. So in just about 2 months, we're seeing that this Omicron has dominated the world as the predominant SARS-CoV-2 coronavirus strain. Looking at the local situation, we can see an unprecedentedly high number of infected cases. So we're now in our 5th wave, and the number of cases is very high. And I haven't seen a peak yet, and I don't think we're going to see the peak this week. And I'm going to tell you why in the coming slides. So it's unpredictable situation, which we're all very worried about. This is probably the reason that why you're here today. So in the past few months that we have lived with the Omicron variant, we have understood a bit more about them. First of all, is the increased risk of reinfection, which means that if you have had an infection before with COVID infection, you thought, oh, I'm going to be fine. I'm going to survive in the current battle. But the story changed. It's because when the South African scientists first discovered this Omicron variant, it looked so different that they couldn't believe it. There are so many new mutations in this new virus. Just over the spike protein region, there are more than 30 new mutations, which makes it very different essentially. So it leads to immune evasion. It looks so differently that the immune system could no longer recognize them. And for this Omicron variant, it leads to a lot of atypical symptoms. In the past, we thought loss of sense of smell and taste is going to be the predominant symptoms. But it's slightly different. We are seeing more cases, especially children coming in with high fever. There's sore throat. There may be more body aches. And worse is the incubation is very short this time. It's going to be just a median of 3 days. And we are seeing that this Omicron variant has an increased risk to the pediatric population. So it means the infection rate has never been so high, affecting the children. And the only way that we're going to help them is really vaccination. And I'm going to talk about the first 3 points first. So there are experiments in the lab showing that this Omicron has a very high transmissibility. It multiplies in the bronchus, which means the upper airway, 70 times faster than the Delta and the previous, of course, the previous ancestral strain as well. So just comparing it against Delta is much more transmissible. And imagine if it multiplies in your upper airway, it means that it's gonna, whenever you speaks, you cough, you sneezes, the virus is gonna be propelled to the surrounding regions and to the person next to you. So the infectivity is very high. But the slightly good news is that it affects less of the lung. So we are seeing less of a case with a severe pneumonia or pneumonitis requiring intensive care admission for the elderly, I would say, for the adults. So essentially, how it works is very different from the previous strains, and it multiplies so fast in the upper airway, leading to its high transmissibility. And you can see this is a curve showing the effective reproduction rate of this virus. Essentially, it means the number of secondary cases that will be arising from the index case. So in the previous search, we are seeing a number of roughly around 2 to 3, which means 1 index case is going to affect 3 secondary cases. But here, you can see this very steep curve here. We are seeing that the reproduction rate is as high as 6. So the median now is around 4 to 6. So imagine if 1 index case can spread to 3 people, and the 3 people can further spread to 9 people. So this is just when R is equals to 3, the reproductive rate is 3. We're now talking about 6 or even more in the coming few weeks. So in just a month, we are going to see at least 200,000 more cases with this Omicron infection. So this is just a rough estimate, a very crude estimate. But this is the reason why I'm saying that we are not even at the peak yet, and it's already scary enough. And the reasons that why we are so scared, I'm a pediatrician, and that's because we're seeing a lot of cases with coming in with infection. They are the children, they're young children coming in with high fever, vomiting, they couldn't eat well, and so they're a little bit dehydrated, and some of them are hypoglycemic. They have a low glucose level because of this of complication arising from the infection. And this is the phenomenon that we have witnessed in different parts of the world. So this is a graph from the States. So the infection rate in children, which is the slightly darker blue here, is 10 times compared to the infection rate at the start of the pandemic. So you can see it's 10 times as high compared to before. And they're also seeing what we call the COVID croup phenomenon. Croup is a serious condition causing an inflammation and infection of the upper airway. Usually children come into us with high fever and difficulty in breathing, coming in with sounds like difficulty in breathing. And it's a serious condition. It can lead to decrease in the oxygen supply to the whole body. So it needs urgent medical attention. So it is a serious condition. And worst of all, the states have experienced a lot of cases with multi-system inflammatory syndrome in children. We call it the MIS-C. So you can see the difference. All the states essentially have cases with MIS-C. Some states have even got more than 400 cases. So it is indeed a very real complications that a lot of countries have been facing, and it has a specific predilection to children, young children, particularly those 5 to 11 years of age. So this is why they are the target group that we, in this webinar, we are particularly concerned about. So what is actually an MIS-C? Why is it so scary? It's because it rapidly evolves to different organs of the body. So the child comes in with very high fever, looks very sick, very ill, and very soon they're going to develop multi-organ failure. It involves the heart. The heart is going to fail. It involves the lung, even involves the brain. They're going to get drowsy. They couldn't recognize you. They may suffer from very serious conditions with the brain. And essentially now we have some preemptive treatment. We have some potential treatment to cure it, but they're just experimental. We haven't got a full hang of what is actually going on. So it is a condition that we're very worried about. And we are actually seeing deaths even in the States. So it's the most developed country in the world. It has a lot of advanced technology. They're still seeing deaths all around the United States. So in some states, like Texas, they have 122 deaths already. A lot of them are due to MIS-C or other severe complications arising from COVID infection in children. It's just showing the mortality data in children. So I'm just doing a rough estimate here. So this time I'm doing an estimate of young children less than 6 years of age because they do not have vaccines to protect them. So imagine if the whole household have not been fully immune, they have not been vaccinated, and young children are not eligible. So they're bound to be infected because of the household member. If we have 400,000 children in Hong Kong less than 6 years of age, with the lowest mortality rate in a very developed country, the number of deaths we estimate is at least 40. And it's very true. In just 2 days, we're seeing 2 deaths. I mean, 1 death, but another one is in very critical condition. It's getting very close, and we are at the moment very worried. So not to scare you, but what I want to do is to bring up how effective is the vaccine. It's the only thing that we can do to protect the children, especially the vulnerable group. And immunization is what we are not unfamiliar with because we have been receiving immunization all our life. It's essentially like a training exercise for our body. So I really like this comic. They show us how we use our dead and damaged viruses or even components of a virus to provoke an immune response without having to get you sick and very ill. Right from there, after the vaccination, it trained your immune system so that they can recognize the virus, and they can protect you with the antibodies that they have produced. So with all the training exercise that you have had, I would say this training exercise against the COVID infection is going to be the most important one that you're ever going to receive. And I've received a lot of questions asking which vaccine is better. Is it the BioNTech or is it the CoronaVac? Which is better? So I can just show you this is because there are a lot of a lot of alcohol out there. They're all good alcohol. They're top notch even, but they're very different. They're different in terms of concentration, in terms of balance and aftertaste. Some people like their red wines, but some that like their whiskeys. So they're like comparing apples and oranges. They're all good. They're healthy for you, but they are different. And so this is how I would describe the 2 vaccines. So for the Pfizer-BioNTech one, they are quite new to us because that's the only RNA vaccine that we are having in the modern era. The platform that is using is actually this mRNA platform, and it's not going to integrate into the DNA, your own DNA, because it never enters the nucleus. Once the RNA enters your body, it codes for the spike protein here. So it's going to instruct your body to produce a lot of these spike proteins. So your body will recognize it as an enemy. It's not something that we are that is normal inside the body. So I would need to build up a gang of soldiers to combat them, to fight this battle. And often, because the replication is very robust, it's going to produce a lot of these spike proteins. In terms, the soldiers that our immune system are going to produce is also very strong. We're going to build a large number of soldiers to fight this battle. So this is why you're always hearing that the antibody response with the Pfizer-BioNTech vaccines is often high. So not only do they stimulate the antibody response, it also stimulates the T-cell memory response. So this is how the Pfizer-BioNTech vaccine works. What about the Sinovac? It uses a different platform, but it's a platform that we have always been using, such as with polio, with the diphtheria vaccines. They're all using inactivated vaccine. The flu vaccine also using this platform that we're very familiar with. So once our body has this inactivated vaccine in our body, we will recognize it as an immune, like a foreign body. So we will produce antibodies as well as we will coordinate our immune system to fight against it. But again, it's only just this inactivated virus. is not a lot of spike proteins as with the Pfizer-BioNTech vaccine. So often we do not see the antibody response as robust as the Pfizer-BioNTech vaccine, but it has its advantage with this vaccine. It's because not only does it contain the spike protein, but it also contains the nuclear capsid protein, because the whole virus is presented as a whole to the immune system. So this means that I would like to give an analogy, is that if you are introduced to me in an occasion with me with a mask on, then the ability for you to recognize me is not as good as if you can see like 70% of my face. So the more you can see the virus or see myself, the better that you can recognize it. So that's the theoretical advantage of Sinovac. Okay, so I focused a bit about Sinovac. So compared to the group that receives dummy vaccines, you can see the Sinovac recipients can mount a very, very good immune response. We can see that the seroconversion rate is more than 96%. It means the majority of recipients can produce an adequate and sufficient immune response. And it seems that the adult dose, the 3 microgram groups, can give an even better response. This is the reason behind using this same dose as the adults with the children. And the side effect, I would say, is quite optimal. You can see the severity is categorized in terms of the grading. So the lower the grade, it means the milder the symptoms. So you can see the proportion of children with a severe reactions, with the grade 3 reactions, is just a very minor proportion of them, very low proportion. And you can see in the real world data, there are more than 130 million doses administered around the world. And we can see very few serious adverse reactions. Most of them are limited to local reactions with the injection site pain and swelling. So it has a very good safety profile. And I like to show this graph because it's very dramatic. It shows how Sinovac helps to control the previous coronavirus surge in Brazil. You can see there are a large number of symptomatic infection back in 2021 in Brazil, right after the start of the vaccination. After first dose, the green line, and the second dose, the blue line, you can see the infection rate dramatically improve. And this has also been summarized by the World Health Organization, showing that Sinovac is very effective in protecting you from hospitalization or severe diseases, although it's not as good as BioNTech in protecting you from symptomatic infection, but it's still a very good vaccine in preventing you from the things that we do not want to see: complications, ICU admissions, or even death. So what about Pfizer-BioNTech? So I'm going to focus a little bit more. So a lot of the parents are concerned that this is a very new vaccine, but in fact it's not. It has more than 60 years of history with the use of this vaccine, but it has not got to a very advanced stage in the past years. It's because this mRNA technology is actually very highly unstable. They have been used in 1995, tested for cancer treatment, but I know, I guess you know how it went, is that it's not very successful. If it's successful, we wouldn't be combating cancer as of now. Right, so the use really only discovered in the recent few years, after we have discovered that we can use a nanolipid to surround the mRNA, making it more stable, as well as with the use of PEG. So it's actually not that new. And if you think it can change your genes, then it's not going to happen if it cannot cure cancer, right? And a big clinical trials in different parts of the world. So this data set is from the States as well from Europe. It's showing that compared to the dummy vaccine here, the group who received the BioNTech vaccine can mount a very, very good response. And some parents may ask, oh, they're only giving a fractional dose of the vaccine to my child. Is it going to be effective? So in adults and in adolescents, they're giving the 30 micrograms, the dose. So for the 5 to 11 years age group, it's going to be just a third of the dose. But still, you can see the antibody response is equivalent, at least not lower than the adolescents or adults in receiving the BioNTech vaccines.
Hi, Dr. Leung, sorry to interrupt, but just to let you know, we're at the 20-minute mark. I'm sure parents would love to hear about some of the risk factors that might be a consideration in terms of vaccinations.
Okay, I'll just move to the myocarditis risk, which I'm saying you will be very concerned about. So on the right is also showing the vaccine efficacy. You can see it's more than 90% of vaccine efficacy. And getting 2 shots of the BioNTech is as good, getting 2 shots of the coronavirus is as good as you get 1 shot of BioNTech. So you can see Pfizer-BioNTech compared to coronavirus, indeed the antibody response is better. But of course, you also have to remember that we have T-cell memory to help us with remembering the virus that I've just talked about. Overall, the safety profile is very good. But some of you might have heard about the risk of myocarditis, and I would say it's very true. It's not a myth. But compared to adolescents, the data on the right I've highlighted in blue here, the myocarditis risk in children, in young children, is much lower, with more than 9 million shots that have been given in the States. Just 12 of them have been identified with myocarditis, and in fact, myocarditis occurs in all age groups, across different age groups and different sex. But it specifically affects adolescents and much lower for the young age population. And most of them basically recovered even before they were discharged. You can see nearly 90% of the children recover even before they are discharged. And now you can see that we have a slightly adjusted regimen in giving you the mRNA vaccine, is because we found that the longer the interval, the lower the risk of myocarditis. So this is real data from Canada showing that if you have been given the doses, the second dose at a longer interval at 56 days or more, the risk of myocarditis, you can see, dramatically dropped. And the second question that you may ask, is it going to affect the efficacy? So the graph on the right basically shows you that even with a longer interval, the antibody response didn't dwindle, didn't drop. On the contrary, it even increased with a longer interval with the second dose of the vaccine. So in fact, this is the rationale behind the current regime in giving the BioNTech vaccine, which is a 12-week interval. You still need 2 doses. 1 dose is not the standard treatment, so you need 2 doses, 12 weeks interval. You're going to receive a fractional dose, the pediatric formulation of the vaccines, and you're going to have it in the thigh region as opposed to the deltoid, to the arm. And this is because we wanted the groin lymph node to fully absorb the vaccine so that less antigens will travel to the heart to prevent you from having the myocarditis risk. So this would really be the end. So I welcome any questions. And if you're really going to have this, remember to wear loose-fitting clothes for your child, because they're going to receive it in the thigh. And you may want to get loose pants for them. So I would welcome any questions that we have from the floor.
Thank you very much, Dr. Leung. So I see Ingrid has posted a question. Can my child with egg allergies get the vaccine, and which one would give a better outcome? Could we maybe take a broader perspective? Like children with any allergies, are they, should they be getting a vaccination, and which one would be better in your opinion?
In fact, because allergies are something that are affecting a lot of the children here. So I'm sure a lot of parents are concerned about the risk of allergy tied in with vaccination. And the only thing that you need to worry are those with very severe drug or vaccine allergies. So if you have a past allergic reactions to a drug or vaccine involving the airway, difficulty in breathing, then this is a time that you really need to see a doctor to get a second opinion whether you can receive the vaccine. But for those, even if you have a severe food allergies, anaphylactic reactions to food, it is definitely not a contraindication for the vaccines. Or if you've just got a mild allergies to drugs, then you can also safely receive BioNTech without any precaution. And it only applies to BioNTech because for coronavirus, basically we do not have a lot of contraindications, and allergies is definitely not one of them. And as for asthma, eczema, hay fever, or allergic rhinitis, there are not precautions nor contraindication to receive the BioNTech vaccination.
Okay, thank you. Here's another question. Have children in Hong Kong lower immunity because of lack of outdoor activities and socialization in the past 2 years?
That would be general immunity, because you may probably have heard about hygiene hypothesis. But I would say your body, if you are born with a normal immunity, then you are going to have the same effect when you receive the vaccine. So the vaccine is going to boost up your immune response if you have a complete and a normal immune system. And I would say those who do not have a normal immune system, they're called those with a primary immunodeficiency. They are very rare conditions. So all of the children should have a normal immunity and they should respond normally to the vaccines. But of course, we hope that the pandemic would come to an end so that our children can go to the community and receive the normal sunlight and outdoor activities. So this shouldn't be your concern.
Okay. Is the off-label use of the BioNTech vaccine safe for children? In Hong Kong, obviously, we've got a slightly different dosage compared to the single package that is meant for children elsewhere.
Yep. For that, I'm just going to quickly show you this because I think you may be interested. So this is not a secretive information. Is available from the CDC website. You can see the pediatric formulation compared with the adult formulation. The only difference is the component which are responsible for the stability of the vaccines. There are very benign components that we usually use in our laboratory. So there are not a lot of differences in them. But if you can look closely into the profile of the pediatric formulation, you can see it has a longer shelf life. It can stay after production for a much longer period of time. So in terms of the angle of the pharmaceutical companies, producing a vaccine with a longer stability is definitely going to be better. So, but I would say it doesn't affect the main component, the important component of the vaccine. So it shouldn't be a concern. So I have personal communication with the Pfizer-BioNTech. It's because we try to secure the pediatric formulation, but it's so popular around the world that we couldn't get hold of sufficient dose of that vaccine for our pediatric patients in Hong Kong. So this is why we have come to the conclusion that we will use a fractional dose, but it is not a concern that you should be having.
Okay, I think there may be a little confusion on this point. Someone has mentioned the Hong Kong government allowed us to book the second dose of Pfizer after 3 weeks, but I believe in your presentation you talk about waiting 12 weeks between the first and second dose for children.
Oh, right. For 3 weeks, I think, oh, sorry. So I think the 3 weeks was meant for the adult population. But since you may have heard that when we have started to launch the Pfizer-BioNTech for the teenage population, we have reduced from 2 doses to 1 dose. It's because of the myocarditis concerns that we have. And this is why we have stopped giving the second dose at 3 weeks. But we have now opened up for even the teenager to receive the second dose, but at a longer period. Is because we want to lower the risk of myocarditis. So if you look closely, for the younger age group, they're going to need an extended interval before they receive the second dose of the vaccine.
Okay. There are other questions regarding children that have had either seizure history or recent surgery. Any of these reasons, relevant reasons not to take the vaccine?
If the epilepsy, if the seizure,
recent surgery or seizure history?
Yes. So if the surgery has been done a while and the doctor has checked that there's no complication, then it shouldn't be a contraindication for you to receive the vaccine. As for epilepsy, it means that you have to have a stable control of the seizure. Then you should be able to receive the vaccine. Of course, we have a minute proportion of epilepsy patients who have very difficult to control epilepsy. For those balancing the risk and the benefit, we will still ask them to go for the vaccination after talking with the parent doctor. So I would say if your disease has been under control, then you should go ahead with booking in for the vaccination.
Okay, I think we have time for one last question. As a parent, it sounds like the symptoms of my child having a cold are very similar to the symptoms of them having a mild case of Omicron. So at what stage, what symptoms do I need to see for it to be an emergency when you would recommend that we call an ambulance or get them to hospital?
Yep, excellent question. So we're seeing a lot of unnecessary admission attendances at the emergency department at the moment, but I know it's very difficult for parents to decide. But I think there are a few warning features suggestive that the patients may have, your child may have an ongoing or evolving MIS-C, or that they have a persistent high fever and they look ill, they look sick they're not feeding well, they're not drinking well, their pee reduces, they're not peeing as much as before, and they're essentially showing they're very tired, vomit several times, then I think if you see these features, then you should just bring them to the doctor, even to the emergency immediately. So not feeling well, vomiting, and if they look very tired.
Okay, thank you so much for setting aside your valuable time, Dr. Leung, to share your insights on the risks and benefits of COVID vaccinations for children. We hope all our parents have found this webinar helpful and practical. Dr. Leung has offered to circulate guidelines for the care of sick children and also written responses to any unaddressed questions. So we will follow up with you all shortly on that. Thank you and have a great day.
Thank you.
Thank you, Dr. Leung.